rupture of the blood vessel. This is called a hemorrhage, a bleeding. It's not any different than a bruise. When your tongue gets caught out in the door and it's all black and blue and bruised, there's tiny blood vessels that are torn. Only thing is underneath your skin and your tongue, it's not a big deal. But if the blood vessel tears inside your brain, it is a big deal. That's the minority of the strokes. The majority of the strokes are strokes that we call ischemic strokes. Ischemic strokes are afflictions of the vessel of the brain, where the blood vessel that is supplying the brain with oxygen and nutrition gets clogged up. Clogged up because there's a clot that comes from the heart and just with this bloodstream goes into the head and shuts down the blood vessel. Therefore, the part of the brain that it was supplying goes without nutrition and the patient has a stroke. Or a blood vessel inside the brain that is over years becoming sludged, shut down, the junk building inside the artery, and after a while it decides it's done, it's closed. So there are two different ways. So those are the two big strokes, bleeding and actually loss of blood flow. Who cares, right? Do we care? Actually, let me tell you why you need to care. Find yourself on the map. The redder the area, the more strokes. We are smack dab in the middle of what we call the stroke belt. Stroke belt, because this is the part of America where, due to many circumstances, people have more strokes. What are the circumstances? High blood pressure, poor diet. Number one, tobacco, smoking, lower socioeconomic status, lack of access to health care. These are the reasons why people eventually end up having a stroke. And it is in these areas, our area, the ground that you stand on, that we are a part of the stroke belt. So do you need to care? Hell yeah, we need to care. What else do you care? It's a preventable disease. You change your lifestyle off a bad lifestyle. You stop smoking. You take care of your blood pressure. All these things that I just mentioned, you can prevent stroke. 100%? No, probably not. But for a large part, you can determine your own fate. If you have a stroke, if you respond in time, we can treat it. You can get to the hospital, certainly not, but we can treat it. It's a third leading cause of death in North Carolina. Every 20 minutes, someone is hospitalized. Every 2 hours, somebody dies. And more than 1/3 of the people that are admitted, more than 1/3 of the people are less than 65. Compared to the past 5 years, the stroke rate in young people less than 30 has doubled. How many of you here are less than 30? Did you just hear the number I said? Some of you are going to have a stroke. This is not a joke. African Americans are almost twice as often as afflicted. They have a higher death rate. It happens at a younger age. And 1/3 of African Americans actually have the number one risk factor for stroke, high blood pressure. You'll more women than men. And twice as many women die from stroke than breast cancer. Richard, how many people have heard of the Susan B. Komen Foundation? How many of you have, in the past year, had a little pink ribbon, or a soda cup with a pink ribbon, or participated in a breast cancer walk, or donated to Susan B. Komen? How many of you have done any of these or more? How many of you have done a stroke walk, or worn a stroke ribbon, donated to the American Stroke Association, or done something to do with stroke? How many? Get my message? It's twice as common than breast cancer. Breast cancer has a very emotional weight to it. It is very, very close and very personal. That is why they believe Susan B. Komen has been so successful in getting it out in the public, and I'm glad that they have. It is a wonderful cause, and we should be able to treat breast cancer, but let's not forget stroke. It is as important, if not more important to you, because that's what you're going to die from more commonly, is a woman dead from breast cancer. $73.7 billion This is slightly higher than my monthly salary. But that's the amount. That's the amount of money that you and me are going to be spending this year on our taxes. That's an enormous amount of money. So I think it's a huge deal. So do we need to do that? Yes, we need to do that. One of the first things that we do when we have a stroke, first thing we do is that you call 911. Are you guys familiar with the signs and symptoms of stroke? Like somebody who has a crooked face, somebody with an asymmetrical face, slurred speech, somebody who's talking like they're drunk when it's in the morning. Well, some people are drunk. Somebody has a slurred speech without alcohol consumption, maybe that's another one. People having visual problems, eyes, and suddenly you start, I'm missing something, I can't see. Somebody who's unable to move their right or left arm or leg, numbness, tingling. How often does it happen to you that your hand goes numb? Right? You're sitting to the home, your hand is numb. When you're playing, your hand goes numb. Yeah, you're probably laying on it or something. When you're 80, when you're 75, and you're not doing anything, you're watching TV, or you're having a conversation, your hand goes numb, something wrong. Most people just blow it off. I probably slept wrong, maybe just had bad food, I was having indigestion this morning, maybe that's why. We come up with the most ridiculous reasons why we can blow off things that are actually important. Because what? Our awareness is not there. This is the reason why I'm here. I want you to be aware. I want you to understand. Because if I told you right now, I'm having chest pain, it's like an elephant sitting on my chest, sweaty, it's radiating to my left arm. Boy, does anybody know what's going on? I have not heard that. If I just told you, no, I had it, this was kind of no. The majority of you are going to say, oh, you probably sound like something. I'm having a stroke. So, I'm not saying that every time you have it enough that you're having a stroke. But if your arm goes weak, your arm should not go weak out of nowhere. Why would that happen? So in other words, we need to get to the point where we are with the heart, that we're aware of the symptoms and signs that neurological diseases cause. So what do you do when you get a stroke, or when you have strokes? What do you do first? Call 911. When mom, dad, sister, brother, call 911, get them to the hospital. Have them evaluate what's going on. And if you are having a stroke, the first thing you do is clot busters, TPA, tissue plasminogen activator. We try to make names as long and difficult as possible, so you can pronounce them. So if you give those drugs, what they are is that, unlike aspirin, which essentially enables unable to stick to each other, this drug actually cuts up the clot. It breaks it down. So you give it through your IV, and if it gets to the clot in the brain, where the blood clot is blocking the flow through an artery, 10 to 30% are actually going to be open that artery back up again, depending on how big the clot is. If I told you now, you have $1,000 in your savings account, that's all you have, and there's a 10% chance that if you spend that $1,000 in blackjack, you're going to actually win $1 million. Would you spend it? Don't answer. So the chances are extremely low that 10% of that drug is going to work. So it's extremely low chance that the drug works. So that's where people came around and said, you know what? If the drug doesn't work, can we actually go into the artery and pull that clot inside of it out? Can we go to ruler that artery? Can we take that clot that went from the heart all the way up to the brain and fish it out? Well, we already talked about this part. Yes. The answer is yes, we can. When you have a heart attack, the heart only is actually in dumb way. And I can say that as a major. The heart is a dumb organ because all it has to be. What happens to the coronary arteries is that the coronary arteries get shut down. Coronary arteries don't block, they don't tear open. So when somebody's had tension in their heart, that artery that is